Okay, so my clinical pattern is a hip labral tear, and it's specifically looking at the conservative treatment of a hip labral tear. The most common demographics for someone being diagnosed with a hip labral tear are women, primarily the ages 15 to 41. Um, some outcome tools you could use with patients who are diagnosed with a hip labral tear include the hip outcome score, which is abbreviated HOS, and the non-arthritic hip score, the NAHS. The history of their current condition, typically you're going to see a mechanism of injury either due to a femoral acetabular impingement, an FAI, or due to trauma. So like it could be sports, it could be a motor vehicle accident, anything like that. Some aggravating factors can include walking, pivoting, prolonged sitting, running, climbing stairs, anything like that. And easing factors really include rest and taking NSAIDs to help with their pain. The 24-hour pain pattern is you'll see their pain will gradually increase throughout the day just with activity and using and walking and going about their daily lives. For the physical exam, there's not really any defined precautions or contraindications that you have to must not do. However, you really should just let pain be your guide throughout your exam and don't want to overly provoke their symptoms and make it worse. For the actual physical exam, for both active and passive range of motion, you could see pain and potentially some limited range of motion in flexion, adduction, and internal rotation. And for resisted testing, they could have overall weak musculature of the hip just due to having change in movement patterns from this pain. And then you could also see weak and painful hip flexors. Next, going on to the accessory motion, you would really only see it limited if it's also limited in their active and passive range of motion. And you could see that distraction could actually really help with their pain and decrease their pain overall. For their neurodynamics testing, it's really going to be negative for both femoral and sciatic. And the special tests that were mainly used to go ahead and help rule in a hip labral tear include FADIR, which is also sometimes called an impingement test, and that has a sensitivity of 75% and a specificity of 43 to 100%. And then there's the Faber test, which has a sensitivity of 42 to 81% and a specificity of 18 to 25%. When you're doing palpations, because of the fact that this is an intra-articular issue, you really can't get to their actual pain, but you can palpate around the surrounding musculature, and you might have pain just due to trigger points because they have different movement patterns or just tenderness and guarding. But it most likely won't be the patient's familiar pain because their familiar pain is within the labrum and the acetabulum. For other differential diagnoses to look out for, you could see referred pain coming from intra-abdominal and intra-pelvic structures, and then you could also have an iliopsoas tendinopathy, a bursitis, a strain, or a tear. Along with that, you could also see the femoral acetabular impingement or a femoral stress fracture or osteoarthritis. The gold standard of diagnostic imaging for a hip labral tear is an arthroscopy. And when you're looking out for any signs and symptoms that you should refer them back to their physician. One big one is really just if their conservative treatment is not helping with their symptoms or their pain and it's just not progressing as expected. And another thing is if their symptoms are progressively getting worse and unremitting, that could actually be indicative of a fracture had occurred or if there's avascular necrosis. And then some surgery indicators really include the referral ones, just like I just said about conservative treatments not helping with their pain and signs and symptoms, but also if they have a femoral acetabular impingement on top of the fact that they also have the hip labral tear, that could increase the risk of requiring surgery. And 3 surgical interventions could include a labral debridement, a labral repair, and a labral reconstruction. Thank you.